Steroids, hormones, and blood transfusions are among the most widely used performance-enhancing drugs. Whether it's Lance Armstrong in cycling, Ben Johnson in track and field, Alex Rodriguez in baseball, or Russia in basically everything, doping is a persistent problem in both competitive and recreational sports. In fact, the problem in Russia has gotten so bad that in 2016 the country was banned from the Paralympic Games entirely and then forced to play under a neutral flag in the 2018 Pyeongchang Olympics. Russia has been credited with one of the most elaborate doping ploys in all of sports history. Guidelines and regulations for doping, including what is considered legal and what is not, has come a long way since the International Olympic Committee first started testing for doping in the 1960s. Among the most common types of doping are steroid and erythropoietin or EPO injections. Anabolic androgenic steroids, also known as AAS, are among the most common form of steroid injections. They work by increasing total muscle mass and strength, ultimately resulting in an increased tolerance for hard training. EPO is a hormone that is naturally produced by the kidneys and can stimulate the production of red blood cells from bone marrow. Synthetic EPO can be injected into the bloodstream to increase the number of red blood cells. This can drastically enhance how much oxygen a person can carry in their blood, ultimately leading to higher endurance and less muscle fatigue, giving athletes an edge over their competitors. In short, performance-enhancing drugs might seem favorable, but do the benefits outweigh the risks? Athletes caught for doping are immediately stripped of their titles and achievements and forced to forfeit their medals. Further, they are also banned from participating in their sport for up to 4 years or even life in the case of repeated occurrences, and of course, permanent damage to their reputation. It is becoming increasingly difficult for athletes to get away with doping, especially at the Olympic level due to advancements in drug testing technology. Athletes are routinely subjected to various blood and urine samples before and after their competitions. These samples are then analyzed for various biomarkers which would indicate the presence of performance-enhancing drugs. For example, synthetic EPO has different acidity levels when compared to naturally produced EPO and thus can be screened for in the blood. Additionally, this blood is preserved for many years and can be retested at any point in the future when screening technologies are improved. For instance, the 2012 Russian Olympic team was stripped of 11 medals after the games were over due to the retesting of older blood samples. Aside from tarnishing an athlete's reputation, there are also a number of health implications associated with doping. AASs in particular have been notoriously known for causing various cardiac complications with prolonged use. There have been various reports of otherwise healthy athletes having sudden cardiac arrest due to steroid abuse. Other prominent side effects include reduction in testicular size, sperm count, and overall sexual dysfunction. EPO injections are also associated with cardiovascular risks, including an increased risk of high blood pressure and blood clots. Other less severe side effects include nausea, headache, dizziness, and allergic responses. Although Russia has recently been under scrutiny for excessive cases of doping with their back-to-back Olympic bans, the problem of performance-enhancing drugs in competitive sport has existed for a long time. As regulations for drug testing and testing technologies improve, and people begin to realize the severity of the side effects, hopefully we begin to see a drastic decline in the number of doping cases in the coming years. Please like and subscribe if you like this video. For more videos like this, visit the Demystifying Medicine website.